Thanks so much for the opportunity to present this today, and thank you for your remarkable leadership over time. It's through leaders and visionaries such as yourself that the sector and sectors focused on disaster management and disaster risk reduction will inevitably come together faster rather than what we've seen over the last decade. Welcome to everybody to this particular presentation. I just, as a note, say I'm going to try to separate this discussion into 4 areas. Each of the areas represents what I consider to be the emergency, the hidden emergency that's facing us as a sector in order to achieve the goals that we are intending to achieve. That is ultimately the reduction of death and the reduction of harm caused by natural hazard disasters. So I want to start off with what my contention is. So my contention is that if we are to, as a global community, achieve this ends of reducing human death and the effects from natural hazard disasters, then the global health community must be able to deliver 3 critical services. And they'll have to provide a life-saving treatment and care of people who are sick or injured as a consequence of exposure to the hazard. They need to try to prevent the illness in people who are vulnerable to the effects of the hazard. And they need to protect the health of the wider community who may not be as vulnerable, but who may also be exposed to the hazard. And if we think about that in the current crisis of COVID-19, that's no small task. The health system is trying to care for those who are sick. They're trying to identify people whom are vulnerable and give them specific health advice. And they're trying to communicate to the rest of the community what their risk is, but most importantly, what they are to do in order to reduce their risk. Now, why am I focused specifically on the Sendai Framework? Well, the Sendai Framework is absolutely critical for us to deliver. If we do not deliver the Sendai Framework, then we will not simply be able to achieve the Sustainable Development Goals. Because unlike any other international agreement, it's the Sendai Framework which is intrinsically linked to the SDGs. And I just wanted to remind you all of the importance of the Sendai Framework with reference to the SDGs. And I won't go through each of these, but you can clearly see the relationship between the importance of what the Sendai Framework for Disaster Risk Reduction hopes to achieve and each of those single targets of the SDGs. So we must deliver the Sendai Framework if we're to deliver the Sustainable Development Agenda for 2030. We only have 10 years. It's not a long period of time in order to be able to achieve these very realistic, they're not ambitious, but very realistic goals in reducing death, reducing the impact and improving the lives of people globally. But no analysis is complete, no analysis is even remarkably complete or realistic unless we understand the context in which we're trying to deliver any kind of program or service or strategy or initiative. And so I want to frame this conversation in the context that we're dealing with now. That is the context that the world's in humanitarian need. And I want to touch on 4 specific areas of this because these are linked and they are essential for us to understand if we are to achieve the goals of the Sendai Framework. We have the highest level of refugees in the world globally, at the same time with a global politic that is convinced of putting up borders and barriers is the most successful way of dealing with this. It's remarkable if we had have taken that same approach after World War II, how very different the world would have looked. But rather, after World War II, we embraced the need to be able to support people and families who were running from conflict and running from war-torn areas in the hope of starting a new life. Yet we've reached a remarkable figure of 70.8 million people today. Well, higher than that. These are estimates from UNHCR from 2018. We've seen the commensurate increase in the use of violence by state and non-state actors. And it's very important for us to understand what that means. Not just conflict between nation states, but conflict within nation states and the increase in conflict within nation states. Global hunger, which we had worked for a decade in order to reduce, because the link between nutrition in children and nutrition in people and their health outcomes are unequivocally tied. Rates of malnutrition and the outcome from malnutrition are so closely related to acute respiratory infections, diarrheal disease, and life expectancy, that tackling the risk of nutrition in children had been what the world had agreed upon over a decade ago, a specific and targeted approach. Yet in the last 3 years, we've seen an increase in global hunger to an estimated 821 million people. Extraordinary, 821 million people for a global population of 7.5 billion. You must ask ourselves, how is that possible that nearly 1/9 of the world population could be hungry, given the amount of food that we produce? We have nearly 2 billion people who don't have access to potable water supply. And lastly, we have a funding gap between the humanitarian need, that is the assistance that's required, and the amount that donors are to give. I just want to break some of this down a little bit more specifically. So if we think about that 70.8 million people who are forcibly displaced, they're separated into a number of different groups that are important, again, for disaster agencies to understand. So 25 million refugees, 20 of them who are under the UNHCR's mandate. We have 41 million people internally displaced. So that is that they are people who are forcibly removed from their homes, but they are still within their state boundary. And we have 3.5 million people currently seeking asylum, plus 5 million Palestinian refugees. If we look at that picture, we could say, yes, but Gerard, while we've seen an increase in rate of refugees, surely that's occurred at a time where our global population has increased. Yes, it has, but we've seen the proportion of people in terms of the world population since 2010 really has started to increase. So this is a real increase. This is not a statistic because of the world's population overall has grown. On the contrary, this is a real growth in the number of people who are displaced, forcibly displaced. I also wanted to graph our IDP because I'll just go back up again. We've got 41 million people who are in IDPs. I wanted to look specifically at what that means from the country where the IDP is based, and importantly, the trend. If we look at all those countries, we can see that for only one of them, which is Sudan, we've seen a reduction in the number of internally displaced peoples. So over the course of a few years, the number of people whom are internally displaced is not decreasing. It's not decreasing. So we think about that context. We think about that context as disaster and emergency responders. That represents a significant challenge for us, because any natural disaster, any natural hazard disaster in any of those countries requires us to understand what the context is for those people who are internally displaced and the risks to them. I want to touch briefly upon the shocking circumstance of global hunger. I want to draw your attention to that figure, especially since 2015 and the increase. We had been, as a world, been successful at implementing programs and strategies and working with communities to look at and to implement enough food and enough systems of food and enough practices that provide the calorific value that people need in order to sustain their daily energy requirements. That's what this is about. How much food do I ingest, and is that food enough energy to manage my daily energy requirements? And globally and internationally, the world, through governments, bilateral agreements, the NGO work, had done a remarkable job in managing this. But the last 3 years, we've seen some frightening and remarkable changes. Now, some may argue that these changes have come about through the reduction in overseas development assistance that's been provided by high-income countries. The programming hasn't changed. The rate of programming has changed. Are there any other factors that are associated with that? Yes, of course. There are other factors such as conflict. There are other factors such as pestilence, and there are other factors such as drought that have had a profound effect. And I'll just come to drought in a minute, but I just wanted to break this down into regions for you to understand this more clearly. You can see the Western Asian crisis is really quite stark compared to every other region of the world. In most other regions of the world, we've seen at least a flatlining, if not a decrease, in the rates over the last 10 years. But in Western Africa, we haven't. There's a couple of reasons why that might be the case. One of the reasons is the quality of the information or the quality of the data. Whether or not the proportion of people whom were undernourished was accurate when we first started is probably the largest area of contention. Because without good information, without good data, then it's very difficult to look at trends accurately over time. What we really needed in Western Asia is some level of confidence interval or a band of width of how much we're likely to see above and beyond what our estimates were. And lastly, I just want to touch on something that you all should be mindful of, and as a sector we should be mindful of, and that is the relative abandonment of the issue of drought and our response to drought, and the role of drought in the increase in undernourishment all over the world, in global hunger. You can see that from this graph, it clearly articulates what the role has been and where we've seen long-term drought with the lack of initiatives or the lack of change of initiatives, especially towards environmental support, environmental repair, where we've simply been using food aid as a means to manage. We haven't been successful, for a range of different reasons that I don't want to go into, that more relate to the programmatic approach that we take to the management of drought, especially as it evolves in the longer term. I wanted to show this is not a particularly good image, but why I wanted you to draw our attention to this is because there are some outstanding maps that provide you with an amazing amount of information just as a pictorial representation. And what I wanted to alert to from this map is the actual size of the size of the red circle, which is illustrating where the conflict is relative to the part of the continent and in particular into some nations. And the reason why that's so important is because these conflicts have been continuing for a significant period of time. One of the questions that we must ask ourselves as a species that is confronted with a threat that we are not being able to control or manage because there's no therapeutic drug, there's no effective treatment, and there's certainly no vaccine. What we have to ask ourselves is, how have we allowed as a species such violence to continue unabated? What happened to our peace building? What happened to our global diplomacy to reduce conflict in particular areas? And this is tied very clearly with this, what I alluded to earlier about the non-state violence. And this is a simple graph of the number of homicides over the last 20 years, well, the last 16 or 17 years, realizing that the last 4 years, the rate in Mexico has certainly jumped. Now, if we think about the numbers on the left-hand side, yes, it is what you are looking at, between 10,000 and 70,000 people. It is an extraordinary number of people whom are killed every year from local violence. And what's interesting is our ability to make some comparisons. People, they tend to be fast to draw conclusions about particular nation states. For example, homicide death in the US is often raised as an issue within Australia because of their laws that they have around their guns. But relative to other countries, it's it's significantly less, some 50% less. And when it comes to Brazil and the current plight in Brazil, it's magnitudes of times less. I want to quickly touch on the last point that I'll make about the context that we're trying to deliver the Sendai Framework for disaster risk reduction and ultimately achieve our goals in reduced mortality and reduced impact and effect from disasters on the world. One of the important things that we all know and we're all mindful of is the extraordinary equity gap in countries. So in the South Pacific nations, rarely do they have a commodity that is saleable to generate enough global domestic product to fund all the social services. They rely on their friends and their neighbours in order to provide humanitarian aid and humanitarian assistance to run programs so that they can focus the income that they generate on developing the communities based on the community need. So overseas development assistance plays a crucial role in supporting communities to be able to provide fundamental services and life-giving services. So I wanted to just briefly touch on some trends in overseas development assistance described as ODA there and map the trend. So this particular graph that I wanted to show is the change of ODA. So that's the total amount overseas development assistance provided by high-income countries and middle-income countries to low to middle-income countries. And we can see clearly that the trend has been, from 2017 or just before in 2016, there's been a significant decline in the amount of overseas development assistance provided. And these years should be somewhat of a surprise to us because the global economy during that period of time had been in a healthy state. There had been no financial shocks. The growth in equity markets around the world have been significant over this period of time. And certainly the wealth of individuals in high-income countries has never been highest over this period of time. So it might be a surprise to see that the proportion of overall ODA, of overseas development assistance, has declined. So I wanted to have a look at, well, what does that mean if we can break this down into the different types of overseas development assistance that's provided typically, and see if we can understand that better or unpack that better. And what this graph clearly shows to us is that we've returned to the old days of lending to low and low middle income countries, lending money rather than using development grants or humanitarian assistance itself. And most importantly, we can see if we look at the proportion of what sector that this ODA and these loans are being directed towards, we can see clearly that local infrastructure development and banking and finance certainly have outstripped all the others collectively. So the key historical support, which are for social systems such as health and education, agriculture, security and social protection, these have been more recently being reduced, and sadly more investment, if you could call it that, be put into the infrastructure and banking and finance of many low and low to middle income countries. I just wanted to touch, given that this seminar is being provided from Australia, I just wanted to touch on Australia's contribution. And this graph is a graph that represents the proportion of overseas development assistance you give relative to your gross national income, your GNI. And the reason why it's important to express it like this rather than in total numbers, because if we look at the contribution that Australia makes, then it could be argued that the amount of money that we have given over the last 20 years has been increasing. That is, the total number, the total amount that we give has been increasing. Yes, that's true, absolutely true. But relative to the amount the country earns, has been a sorrowful state. And from 2013 till now, the proportion of humanitarian assistance, the overseas development assistance that we provide and that we finance, has been falling starkly. And this should raise some questions of morality and ethics in the hearts of all Australians who live in a country who has seen unparalleled wealth. You're wealthier as individuals more than you have been at any other time in your history. And yet, you gave more as a proportion of humanitarian aid after World War II than what you give now. And this should raise some questions about how wealthy does this nation need to be before it starts to provide its fair share of assistance to other countries whom, as we'll see later in the presentation, are trying to live on less than $2 a day. $2 a day. It's an appalling situation and an embarrassment to this country. So, given that that's the context we are working in, let's think about what I argue is, or what I contend to argue are the 4 barriers that we are facing to deliver the Sendai Framework. We only have 10 years, and these are what I describe as the hidden emergency. Unless we tackle these particular 4 elements, then we will not be able to achieve the Sendai Framework. And should we not do that, then the ability to deliver the Sustainable Development Goals is compromised. So the 4 areas that I want to look at, or the 4 issues, the emergency we must contend, is that there's a contrasting, my view is there's a contrasting concentration of effort on what we perceive as risk from natural hazard disasters compared to what the underlying or causative risk from natural hazard threats are. The second issue that I want to talk about is the misalignment across our sectors. So these are all the sectors that manage or are trying to reduce the death rate and the impact from natural hazard disasters. So this is the DRR sector and the disaster management sector and the health sector. There's a misalignment within the risk triangle of what we understand is a hazard, is exposure, is vulnerability that represents risk. Risk is a function of those 3 things we've led to believe, but there's a misalignment of what we understand. We have to deal with this misalignment. The third element that I want to talk about is the what I describe as the discordant nature of the Sendai Framework disaster risk reduction when it applies to the responses we have for countries whom are known to be in fragile or conflict or violent states. And the last is what I describe as a fatal flaw within the measurement or the calculation that we are to use in order to calculate deaths from disasters, for us to understand whether we are actually reducing mortality or mortality is not being reduced by our efforts. So let's get into the first particular issue that I see. So this is a contrasting state between the perceived risk and the underlying causative risk. So what I'd like you to do as we go through this is to ask yourself the question, the activities and actions that we manage or run or implement within communities, the disaster risk reduction approaches, our approach to disaster management, our approach to health, are these initiatives and actions, are they focused on reducing the risk from the hazard, or are they focused on reducing the amount of damage or harm that's caused by the hazard? So our activities and actions that we do, and many of you have implemented within communities, were they targeted at reducing the damage, or were they targeted at reducing the risk from the hazard? Now, it's a fair question to say, is there a difference? And if there isn't a difference, well, what's the point of this conversation? If there is a difference, what's its significance? So I'd like to unpack this question and look at it more specifically. So I've listed in this table what the common and most functional areas are for health, disaster management and disaster risk reduction on the top of the table. And I said the way that we approach historically and presently our reduction of risk is to develop policy and legislation that focuses on how we plan and build and construct infrastructure. And the idea, the principle is, well, if we focus on infrastructure development and planning and government policy at local and state and national levels and international levels, are we able to then improve the circumstances in which people live and prepare them and reduce the risk that the hazard imposes from damage to the infrastructure? We know that there's been an enormous amount written and researched on early warning systems. If we are able to give communities enough early warning, are they able to avert exposure to the hazard and thereby reduce the risk at which the hazard poses to them, either physically or materially? We develop an insurance and finance mechanisms in order to protect people and therefore reduce the risk of the shock from economic damage that's done to infrastructure, that's done to crops, that's done to livelihoods. And lastly, an important disaster risk reduction approach that's often forgotten is the emergency response that we implement at the onset of the hazard. Indeed, the emergency response is where we're likely to see the largest gains in reduction of death. If we think about the COVID-19 scenario, it's our emergency response to this situation that's going to reduce death, and how effective we are at implementing that program of reducing the risk. So I wanted to look at these 4 key areas. Now there are other activities certainly, but I wanted to try to condense this conversation, this analysis down into these 4 key areas. And I listed different hazards on the left-hand side of this table for us to see, well, do we, in each of these hazards, apply these 4 key strategies or parts to reducing the risk of harm from disasters? And in my reading of the literature and in my attempt to find examples from each of these hazards where we have either a government policy or response by NGOs or local communities or local businesses, there's a clear example I was able to find for each hazard of precisely these actions that are undertaken. Recording case studies, a range of different approaches in order to reduce the risk. The only thing that I was unable to find is the space weather or the impact from sunbursts. I wasn't able to find any approaches that were taken to respond or reduce the risk to these. So that's why it's unknown. It could be from just my inability to find them specifically. So if I just go back to this question, are our current activities focused on reducing the risk from the hazard, or are they focused on reducing the damage caused by the hazard? These activities are universally applied to us, to humans, to our community, to the human species. All of those initiatives applied to the human species. But as an entity, we can't, as a community, we can't exist. We don't exist outside an ecosystem. We are part of an ecosystem. And all of those hazards, all of them, impact the ecosystem. So all of these hazards damage the physical environment in which we live. And what I mean by the physical environment, I mean the ecosystems, which includes all plant and animal species. But none of these seemingly are specifically targeted, either prior to the hazard event or after the hazard event, at reducing the risk of harm to anything other than our own species. And this has to raise some serious questions for us. It has to raise some serious questions for us because any observation of the effect of the bushfires in southeastern Australia last year and the decimation to the environment can only lead to the unfortunate and sad conclusion that there can be no community resilience unless that environment is restored. As a community, we can't live without safe water. We can't live without clean air. We can't live without sustenance, and we can't live effectively without a healthy environment. It's simply not possible. If we think about these hazards not only destroy or affect the physical environment which we live or try to live, but what they also do is they create the perfect environment for another hazard to cause even greater risk to us. And it works both ways. Some of the initiatives that we implement seek to try to control the hazard. Flood is an excellent example. Earthquake is an excellent example. We try to control the environment relative to how the hazard affects us. But we forget or have forgotten about the rest of the environment. So I want to drill down more specifically in this and use a very practical example. It's an example of the current situation that we are facing as a global community, not as a single country or a single entity or a suburb within which we live. So as of today, COVID-19 has infected more than 400,000 people that we know of. Of course, we are not going to know the scale of the COVID-19 infection until we start running serological surveys of the amount of people that were exposed to the virus that may have been asymptomatic, that is, they didn't develop any symptoms. They may have developed symptoms, but they weren't enough for the person to recognise they were sick and needed assistance. We need a large seroprevalence survey in order for us to understand that. What we have at the moment is simply a record of the number of people whom have been tested and have been found to be infected. So we have 400,000 known infections across 169 countries and almost 19,000 deaths. And if we map the trend from the middle of January, which is not the first case, it was well before then in December, the first cluster that was recognised from the market, we can see how quickly this virus has transmitted between us and across us. So the question that we raise ourselves is that we have to ask ourselves is, well, how has this come about? What are the circumstances that have led to this? And it's quite easy for the human population to argue, well, the virus amplified in bats, and then through contact and inappropriate handling of bats, we have the virus has crossed into the human species. It may have been through another, it may not have been, and now we have an infectious agent that can be transmitted from person to person. It's too simplistic an analysis, and in fact it misses the whole point of this conversation. We should be looking a lot deeper at any kind of analysis as to what the origins of this infection are, and the role of humanity and the role of us as disaster response personnel in its existence. And I just wanted to touch on a really important cycle from SARS-CoV and MERS. So we know that these viruses are amplifying in different species. Absolutely, we know that there's transmission, the evolution of the virus, which is able to pass from one species to another species and then move in between species. And it's a simple example of SARS-CoV from 2002 to represent that pictorially for you. But I want to examine this a little bit deeper. We've seen the emerging infectious disease scenarios grow, especially over the last 20 years, but really over the last 100 years. And the reason why we're seeing this growth is because as we, as a human species, continue to affect and deteriorate the living environment of other plants and other species, that creates stress. It creates stress in other species and the opportunity for contact with other species as other animals need to also contain the living space that humanity is is pursuing. And so it's no surprise that, especially, and if I just wanted to the emerging nidoviruses, I just wanted to present to you that the important table that's looked especially over the last 20 years or 25 years, and the species that have come from. So the evolution of different viral agents in pigs and in cattle, and our contact and our treatment of these animals and the environments in which they are living for them to be exposed to different agents that enable the interaction, which ordinarily shouldn't or wouldn't have occurred. And that's translated for us as a human species to create a risk that we are not managing and we are not focused on. Where in our list of disaster risk reduction activities or policies or legislation is there any statement of the care for or the nurturing of or the restoration of the physical environment which other species live in order for them to maintain their existence without viruses amplifying, without species becoming stressed, and without human populations coming into contact that's significant enough for these pathogens to invade the human population. So I wanted to move and articulate our perceived versus underlying causative risk in this simple way. What I wanted to do is to describe risk in a number of different elements. So you can see down the left-hand side of this table is what I describe as the threat. So the threat, what I've listed as is infectious diseases, non-communicable diseases. I've listed inequality as a threat, and I'll get to that in a minute. Natural hazard disasters, what we are all here to try to do something about. Pollution and environmental damage, climate change, and the planet's biodiversity. So the current risk I've listed in deaths per year, except for natural hazards, which is the data taken over a decade, and except for inequality, which I've listed as how much people are trying to live on per day. So, and what I tried to do is characterize our response to these particular threats and risks by what our global governance response is, being mindful that there are definitely and unequivocally local actions that are taken to try to address some of these risks. There are government initiatives that are trying to address these risks, policy and legislation. And what I mean by policy and legislation, I mean specific health programs or initiatives that are targeting these issues. Yep. So Australia, for example, have remarkable approaches to diabetic management, not so much in our Australian Aboriginal population, but certainly in the southern states they do, and for access to treatment and care for communicable diseases. That I wanted to look at this from a global perspective, and therefore tried to identify specific global governance structures or entities that are addressing these risks, the threat. And what we can see is if we can draw a comparison between what we perceive as being threats, so the threat to infectious diseases, yes, you shouldn't be surprised at HIV and TB, and the proportion of people who still die every year. So that 2.3 million people is per annum. Extraordinary. Diarrheal disease is still a leading cause of death in children and adults for much of low-income country world. And how can that be the case, Gerard? How can diarrheal disease that doesn't require any medical treatment necessarily? The first-line treatment for a person with diarrheal disease is rehydration. How could we let 4.9 million people die from diarrhea and lower respiratory and common infectious diseases? That's remarkable. NTDs is neglected tropical diseases. I thought I'd put that in there. And the reason why I've listed NTDs is because they are neglected. These are diseases which we've known known about and in some circumstances like tuberculosis, have a clear understanding of its treatment and requirement and the way that which we could prevent sickness and illness in people. Again, 1.1 million deaths per year from neglected tropical diseases. The estimates for non-communicable diseases, and I've only listed three, so cardiovascular disease, neoplasms, cancer, and chronic respiratory disease. That's taken from the 2015 GBD data. So that's the global burden of disease data that's published in the Lancet. And we can see per annum in the millions. So now we come to this idea of inequality, and I just want to touch on this now. So we have 736 million people currently living in the world who are trying to live on $1.90 per day. And 1.2 billion, and the reason why I've got that 736 is because that's what the world describes as extreme poor. So if you earn 1 cent more than that, you're not extreme poor anymore. It doesn't make much sense to me, but nevertheless, if you earn between $1.90 and $3.20, according to the World Bank, you fall in the next category, 1.2 billion people. So we already have 2 billion people in the world who are trying to live on less than $3.20 US per day. Not enough to buy a cup of coffee in Melbourne. And for another nearly 1.5 billion people, they're trying to live on between $3.20 and $5.50 per day. So we are still living in a world where inequality and inequity is profound. And if we think about that and the graph that was displayed earlier about Australia's contribution to overseas development assistance and its reduction to its lowest level since World War II, the lowest level of proportion, the amount of overseas development assistance you give as a country, it should give us pause for thought. And then we come to one of the reasons why many of us are working in the occupation, and that's a natural hazard disaster risk. Now, what's fascinating about these numbers of deaths is that they're over a decade. A decade, wow. So 2.3 million people die from HIV and TB every year, and earthquakes have conceivably, plus or minus perhaps 10%, of course 360,000 deaths. But our fear, our perceived risk from an earthquake is much greater than it is from our understanding the risk of HIV and TB. And this represents a problem. Represents a problem for us because if we consider the last three threats within this table, that is the amount of pollution, deaths from pollution globally, the potential death from climate change, and death from the damage done currently to the planet's biodiversity and natural ecosystems, that pales into insignificance. Now, the Lancet study estimated that 9 million people in 2016, so 16% of all deaths globally, 9 million people died as a consequence of pollution. 9 million in a year died. The World Health Organization estimated some time ago that between 2030 and 2050, there'll be more than 250,000 deaths every year as a consequence of the changing climate. And last year, the IPES report estimated that we are on the precipice of the extinction of 1 million species on the planet. And indeed, their analysis of 40,000 scientists was that the survival of the human species is at stake. Now, what's extraordinary of this table, and what comes back to the whole point of this, the aim of this conversation of where we are directing our disaster risk and disaster risk reduction initiatives, if we think of the global governance response to the three most critical and risky elements, which is the pollution, climate change, and the planet's biodiversity, there are none. The Paris Agreement really is not going to halt the increase in temperature. The Paris Agreement is going to try to reduce the amount of carbon that's in the atmosphere. It's not going to prevent us from achieving an increase in global temperature. It's not designed to do that. There was no agreement around setting specific or explicit targets. And most worryingly, there was no correlation between the activities needed and a reduction in the temperature. So even though the Paris Agreement's there, it's quite weak. So as a sector, what are we going to do? What do we need to do? Well, we need to change a whole range of different areas, and the first thing that we need to do and understand is that we've created a humanitarian program cycle, and that humanitarian program cycle says that we need a stronger, more relevant analysis. Excellent. We need to prioritise people-centred response. Yes, everyone would agree with that. And then we need to monitor what's being initiated in order to ensure that it's working. And now no one would agree with these principles. There's only one fundamental problem that's associated with this, and it relates back to our risk table, is that the environment is absent. You're prioritising your risk strategies and your risk reduction strategies in the wrong place. You're targeting people's infrastructure, not environmental ecosystems. These are the things that we need to live and survive. If we continue to damage them, as the table shows very clearly from a pollution perspective, if I can just highlight this, from a pollution perspective, this number is simply going to rise. And from the species and the ecosystem that we rely on and the interaction of the ecosystem that balances life, that allows us to have potable water, that allows us to breathe clean air, that allows us to have agriculture that produces the food we need. Unless we address that, we could implement every disaster risk reduction strategy for all of the hazards and we're still not going to reduce the number of deaths. So I'll just close this. So this enhanced humanitarian program cycle that's hot off the press of UNOCHA, it needs to be amended. And if we think about the World Health Organization's risk approach, and it's a risk approach that's being used to manage COVID-19 now, it's been the risk approach that's been used that has underpinned the response to Ebola. It's that for us to understand risk, we need to understand the hazard, we need to understand the context, and importantly, we need to understand the exposure. And unless those three elements are within our design for a response, then we will mischaracterize risk, just as we've mischaracterized and misunderstood the risk to the ecosystem of which we are only one part and which we continue. So what do we need to do in order to revert this? Well, firstly, what we have to do is we have to have near universal recognition of the damage that's caused to the physical environment. And that physical environment includes the whole ecosystem, all species and all animals and all plants that are caused by natural hazard disasters. That's the starting point for us as collective sectors. The next thing that we must do that's absolutely essential is we must start to design dedicated responses and activity plans to restore that. You look at the damage done to the bushfires, how much effort and energy is being placed into restoring or nurturing the earth to restore the mycoflora that need to exist, that are a fundamental part of the forest system. Very little, certainly in Eastern Australia, different in South Australia, where they're caring for animals and what the animals need to survive. But we need dedicated plans, dedicated programs that target all species to protect and restore the damaged environment. And why this is so important is because as the understanding of compounding hazards becomes more apparent, and we saw that again in the Eastern Coast fires, where the fires were followed very quickly by floods. If we remove the physical environment, then natural systems that are ordered to mitigate floodwaters no longer exist to protect the floodwater. And so the secondary hazard, the flood that came after the fire, it causes more harm than what the fire does. So these must be created, and we must start to fund these initiatives now. We must start it from the sector. These are the two most important things that we can do now. We must start talking about it. We must start designing programs to address this hidden critical need. From a leadership perspective, we need a near Copernican revelation in the United Nations Emergency Program. It is frightening to note that their flagship report's called the Global Environment Outlook. It's GO6. It did not mention at all, not once, on any occasion, the damage the planet, the environment faces from natural hazard disasters, the damage caused to our physical environment by natural hazard disasters, and what's need to be done to prevent that damage. Yes, absolutely. The report mentioned disasters and the disaster of urbanisation and the impact of urbanisation and the impact of climate change and the impact of people, but nothing of disasters. It is a remarkable omission, perplexing in fact. We need the UNEP to rethink and re-understand their role in global leadership around natural hazard disasters. And I would argue that we need them to adopt a One Health style initiative between themselves, UNISDR or the United Nations Disaster Risk Reduction Agency and the World Health Organization to refocus the attention to bring multiple disciplines together in order to address this hidden emergency. What do I mean by One Health? One Health is an initiative that I encourage you all to look at. You can just do a quick Google search. What it is it started maybe 30 or 40 years ago, and it was a recognition by veterinary scientists that there is a relationship between the animals that they're trying to care for, the environment, and human health. But as vet scientists, they couldn't do anything about that. So a group of human medical doctors and veterinary scientists and environmental scientists, so evolutionary biologists, agro-farmers, a group of people who are foresters, a group of people whose discipline and expertise exists within the environment, they got together. They got together and they started an initiative called One Health in order for them to understand each other's disciplines and how each other's disciplines fit together to represent risk to the human population that comes from animals living in a deteriorated environment, and what we could do as a people try to reduce this threat. One Health is a model. It's an excellent model of how you can bring disciplines together, and these disciplines can, by working together, identify where risks are and then manage the risks. Indeed, One Health has focused exclusively on zoonotic infections. Remember, zoonotic infections coming from animals and what the risk is to humans and how we manage and treat them. And through the One Health initiative, we've seen programs that focus on the environment to improve the environment, on animals to improve the living conditions and circumstances for animals, and importantly, reducing the risk of those infections in both animals and in humans. And the last point that must occur in this space is we must have a separation between consensus expert opinion and the political process. Now, all of you may have been watching the way that politics has been involved in the COVID-19 situation. We shouldn't have politicians making decisions around COVID-19. These should be left to a consensus expert opinion. An expert opinion should be a collective of people from different areas of life in order to understand what is the best course of action. Now, the reason why I'm saying this is because we've seen how such approaches have worked so successfully in the past. It wasn't a miracle or some fate that reduced Australia's HIV reservoir of infection. It was because at the time that HIV emerged and was exploding through different communities, the Australian political leaders at the time sought to seek the opinion of a consensus of experts to know which way to respond, to know how to respond. and they left those decisions in the hand of experts. This is what is crucial. And it's crucial for a couple of reasons. One is because as we move into a more fragile environment, and as we move more towards a climate-affected world, the need to take urgent action must be communicated from the expert opinion directly to the people, irrespective of the politics. It's the only way communities can understand what needs to be done and should be done. If we allow politicians to make those decisions, we are allowing a political process to distract or distort or misunderstand the risk. Now, what do I mean by this? And I don't want to labour this point, but it's very important. The World Health Organization warned the world in no uncertain terms that it needed to take hard measures early. The unequivocal message for COVID-19 was you cannot act fast enough. From all our expert opinion, from dealing with not just SARS, but MERS and Ebola, what we knew is that the community had to take extreme measures in order to interrupt the transmission and in order to protect people. But looking at our curve, we have to ask the question, how was it governments did not heed the lessons of this expert opinion? Why were governments so late to respond from this expert opinion? Now, some political scientists might argue that the nature of politics is a barrier in itself. Well, we need to remove the barrier. And that's why it's using this example with COVID-19 and the role of politics in affecting the expert opinion. Many could argue that Australia should have taken far more extreme measures in social distancing, in closing schools much earlier. So I'll leave that there. Given the time, I might continue if that's okay with everybody. I'm a little short of time. So I just want to take on to the next issue that we face as a sector. Again, it's a hidden issue and we need to address it if we're going to deliver the Sendai Framework. So you're all familiar with Crichton's risk triangle, and Crichton was an insurance consultant in the UK. And really, I haven't been able to find prior to Crichton, when he published this understanding or idea of the importance of exposure when we try to manage risk. But what Crichton said in his risk triangle, he said, well, a risk is a bit like a triangle, and there are three sides. One of the sides is exposure, and one of the sides is hazard, and one of the sides is vulnerability. And if you remove any of the sides, we remove any of the sides of that triangle, well, the triangle doesn't exist, the risk doesn't exist. Crichton also said, and why his risk triangle was such a fantastic representation of risk, is because he said, similarly, as you increase the side, so as you go up from each of the side, you increase risk. So I'll just see if I can make that. So if I increase the hazard, the increase goes up. If I increase the vulnerability, I increase the risk. And it was his way of trying to represent this triangle, the idea of risk and the variables that create risk. So risk is a function risk is a function of these three variables. So, oops, I better remove these. So I want to have a look at this relative to looks like they're going to be there for a while. I wanted to have a look at these three elements relative to our IDR peril classification system, because there are two ways that we classify hazards, but the sector is very clear about how we classify hazards, and we have created a family, a main event, and a peril. And so it's relatively structured and it's relatively clear across the network of actors that are involved in disaster management, disaster risk management. And, oops, I don't know what's happening here. I'm sorry, folks, just give me a minute. Let's see if I can clear all drawings. Let's close that. Let's go back down. And we've developed, or different agencies within hazard management, hazard identification, have developed different scales of hazard intensity. And what I tried to do was try to find a couple of different scales to share with you, to provide you as an example for some of the hazards. So for the earthquake, we've got different scales, of course, and different countries have different scales as well. But for earthquakes and tsunamis, we have the seismic magnitude scales. We've got the heights at the shore and the maximum run-up of the waves on the land as a scale. For flood hazards, we have a scale that measures the water height that corresponds to a particular classification, whether it's either a minor, a moderate, or major flood. For extreme heat, we don't have a universally accepted definition, and different countries use different definitions for extreme heat, but nevertheless there are scales in which that they use. For drought, there's no specific metric provided for drought. Generally, the drought is measured as a scale of the amount of rain deficiency. And in wildfire, we don't have a scale of wildfire other than adjectives that relate to risk. And for a biological or for a disease, we don't have a scale. Now, why I'm raising this particular point is because we have, and I just wanted to include, this is Australian Bureau of Meteorology's approach to categorising tropical storms. In other parts of the world, they're known as different things, hurricanes, typhoons. But for tropical storms, which is the Australian way that we manage that, we looking at wind speeds and gusts in order for us to categorise the hazard, to develop a scale. But as the health sector, which is one of the key arms at trying to reduce the risk from the hazard, we don't actually engage in scale development, scale management, scale identification, and most importantly, we don't correlate the scale typically with our response, except for cyclones. That have been very effective. So once we get to a certain category, then the health system makes a decision whether or not to move people who are at risk, that are in hospital, that are in our care, whether to move a hospital, where to move them to based on the measurements taken by the hazard professionals. But other than that, we take a very passive approach to the categorization of hazards. And this leads to a problem. It leads to a problem because we're not sure how to respond. How does the health system respond to drought? How does the health system communicate the risks as a drought continues if we don't have a base by which we can explain to the community the level of risk? And I wanted to just draw your attention to the example of the problem that we face in not being able to understand or relate the scale of risk to a health response, is that after the 2019 influenza pandemic, there was a profound amount of work done on influenza planning. How do we plan for the community? How do we plan business continuity? How do we maintain good supplies and supply chains through the disaster event? One of the good questions to ask is, well, how of all that planning and all the management that was undertaken and the investigation undertaken, how successful has that been for our COVID-19 response? Or has time, as it often does, and the lack of investment in maintaining these plans, these disaster management plans, have they reduced the original plans to the dust piles as bookends? So let's look at vulnerability across the sector. So that's for hazard. Let's look at vulnerability. And what I thought best to be able to do is plot the path that the UN has taken in defining what it means to be vulnerable. Academic and scholarly literature is a whole different area, and an immense amount of work has been done in trying to describe, explain, evidence vulnerability from in a range of different scholarly pursuits. But certainly from the UN, there's been an evolution of the word vulnerability. But I just wanted to start by saying that the word actually derives from the Latin vulnerabilius, which is a combination of two words, vulnus and vulnari, which means to wound. It was actually a term used in the Roman days during war, where a soldier was vulnerable because they were injured and they needed to be moved. That's its origins. But where has the UN created their definitions, and how has that morphed? So in 1992, the focus was on the degree of loss. So how much loss? So something was vulnerable related to how much loss. A little confusing, you might say. Advance some 10 years, 12 years, 10 years to 12 years. And then the term vulnerability became about conditions of physical, social, economic and environmental factors. So sort of a whole society approach, and how susceptible that whole society or whole community was to impacts. And this idea of conditions or characteristics sort of then followed through, and has followed through to the current definition, which is online, which the UN says vulnerability means conditions that are determined by a whole range of different factors which increase the susceptibility to hazards. But the health sector, that's about as far away from understanding anything as we can imagine. Vulnerability for the health sector is used in two different means. The first is, well, what's the threat to you as an individual caused by exposure to a hazard? That makes you vulnerable. That's your vulnerability. The second area of vulnerability is, well, what's the risk posed to the health system? Again, the COVID-19 provides an excellent example of this. This threat would remove the health system. And what I mean by remove is it overwhelmed the health system. If all the staff that I need to run the hospital are infected and unwell, who runs the hospital? Who cares for a person who's in a motor vehicle accident if there are no staff at the hospital? Who cares for a person who experiences heart failure and arrests? Who cares for the person who has a stroke and needs urgent emergency medical care? Who cares for the person who has an asthma attack, a young child, if there's no one at the hospital? Overwhelming your health system is not just about COVID-19. It's about the care and management of everyone in the community from a whole range of different health risks. So vulnerability to our health system is an important issue. And one of the disconnects, I think, is that the way that vulnerability is seen or perceived by the health sector is so dramatically different to the way that it's seen by the disaster risk reduction community, because the actions that the health system takes in order to reduce vulnerability are very different to the actions or initiatives that are undertaken to reduce vulnerability by DRR and disaster management. It's seen very differently. And lastly, I want to touch on exposure. So exposure would have to be the least developed variable of Crichton's risk equation. And what do I mean by that? Well, the UN currently haven't defined exposure. They don't have a definition for it. Oh, there was one definition a long time ago that was used that related to biological element back in I think 1994. But currently the UN terminology has no definition for exposure. And what's surprising is that the area or idea or principles around hazard and vulnerability have been so well studied. The literature, the published literature and the grey literature around these two areas of the risk triangle are phenomenal. But such little is written about exposure. And what's surprising about that is unlike vulnerability, and vulnerability is something that we can't necessarily do anything about. If we are vulnerable because of our income setting, we can't magically change the income status of a community. We can't magically change the topographical situation and where historical homes have been located and developed in fields and in paddies. We can't do anything about that. We can't do anything about that vulnerability, but we absolutely can do something about exposure. We can reduce the exposure to a hazard to the population, but yet it's the least that has been developed. So I don't have a reason or a rationale for why that's the case. I guess where I landed with thinking about this and in reading and trying to find why there had been this limit in understanding exposure is that maybe given that no particular organisation or scientific discipline is responsible for investigating or studying or measuring the human exposure to the hazard and relating the human exposure to the hazard to the effect that we see. So how much damage is done by these different hazards to this population based on this much exposure. Perhaps that has something to do with it. I'm not sure. But either way, oh, here we go. So 1992, they looked at the UNDHA looked at a definition, but they were relating this to the exposure of living organisms and germs and toxic substances. The UNICR defined exposure as people, property, systems or other elements present in hazard zones that are thereby subject to potential losses. That's odd, isn't it? How does this apply to COVID-19? So what we're saying is that exposure would mean property, systems or other elements present in hazard zones. I'm not sure we could clearly measure that. The UNICR in 2012, the presence and number of people, property, livelihood systems or other elements in hazard areas. So this is following very much an insurance risk definition. So these definitions that have been adopted by UNICR are about all the things that exist in an area rather than what's the relationship between the hazard and the individual, or measuring that or understanding that relationship of the exposure. I'll quickly move through this. So within the health sector, we think of it as being the forced or influence. Again, it's the interaction, relationship between a hazard, whether that be chemical, physical or biological, and us as an organism or the environment. So what do we do about this disconnection? What do we do about this paucity in exploration in one of the key areas of the hazard triangle of exposure? Well, the first thing that we need to do is we need to divert our attention to exposure. We need to start studying it. We need to start better defining it, and we need to start studying it. How do we go about doing that? Well, that's really that leadership's required for us as a sector, that we start writing about it. We start writing about exposure risk for vulnerable populations. And the irony, I guess the great irony is if we are able to shift our thinking away from vulnerability and hazard towards exposure risk, we can start measuring or testing the interventions, the risk reduction interventions. How effective were they at reducing exposure risk? And if we're able to reduce exposure risk through the program, is that program able to be extended? The sector uses the word scaled to effect a greater risk and reduce the amount of damage that's done. We need to come up with some exposure metrics. Now this would be very difficult. How do we understand how we measure exposure? Because for each different hazard it's going to be different. And the danger, I guess, is that we misunderstand what we're trying to do. What we're trying to do is understand this variable and how we can draw attention to that variable to create programs that reduce or eliminate exposure to risk populations. And if we're able to do that, and COVID-19 again is a great example. if I'm not infected, am I exposed? And that's different to the impact of COVID-19. I'm impacted by COVID-19. The university is closed. I'm not able to go to the university. But am I exposed to the virus? They're different questions, aren't they? And they require different attention by different disciplines. We could take an economic view. What's the cost associated with the hazard? What's the cost associated with COVID-19? That's an impact question, right? But my exposure to the virus is a different question. And in order for us to save lives, in order for us to prevent death, in order for us to achieve a reduced impact, as the Sendai Framework for Disaster Risk Reduction is asking us to do, we have to unlock both of these. We can't rely on one. It has to be two-way. So the last point that I've had, the solutions and leadership, and this has to come from the sector universally. There's not one entity that needs to drive this, but we need to understand the relationship between exposure and mortality, and that is not simple. For a virus, it's relatively straightforward. For a flood, it's far more complex. For an earthquake, for a storm, it's far more complex. It's just not as simple. And the reason why it's not simple, for reasons of which I will get into in the next two issues. So if everybody's still alive and well, that's good. You must be tired of listening to the droning. You probably need a break. Given we're a bit short of time, I might press on. I want to look. I'll go through quickly these two points. One of the challenges, one of the hidden emergencies is the discordant, what I describe as a discordant nature of what the Sendai Framework asks and what we deliver in terms of response for fragile conflict and violence states. So I just want to quickly give you some background, yeah? So the World Bank categorises low-income countries and territories, and one of the categorisations that they use is for FCV, or conflict, violence and fragility, yeah. And most recently, so the World Bank last year identified 35 countries and one territory that met that criteria of an FCV, yep, 35. And based on those trends that they've seen and the emerge, and we can clearly see from some of the data that's been presented here that the conflicts and violence is escalating. And so the World Bank predicts about 43% and between 43 and 60% of the world's extreme poor will live in such contexts within 10 years. So why that's such a shocking thought is because if we understand the impact and effect of a natural hazard disaster on communities that are affected by conflicts and violence, we quickly realise they are the most fragile and susceptible people on the planet. They are. And the data supports that. So one analysis by the World Bank showed that more than 420,000 fatalities and 771 million people were affected by 500 natural disasters over the last decade. It's extraordinary. And what the published literature shows is that even in more stark context. So in the 4 years between 2005 and 2009, half of all people affected by natural hazard disasters lived in these contexts. Disaster deaths on average are 40% higher. And in the decade between 2004 and 2014, 58% of the deaths from disasters occurred in countries in the top 30 most fragile states. And one analysis, an analysis that I encourage you all to read, and I've included the reference in the bottom of that slide, is that between 1961 and 2010, 14% of the approximated 5 million disaster deaths could be contributed to conflict. But here's the most important thing. What the study showed was if we controlled for socioeconomic and geographic characteristics within the study frame, that 700,000 deaths could have been avoided if the area hadn't been affected by conflict. Hadn't been affected by conflict. Not only does that remarkable study by Mark Tanner and his colleagues show that not only are they high risks, but if we had have removed conflict from the scenario, those deaths could have been avoided. So if our aim and the aim of the Sendai Framework is to reduce global mortality, we have to do this within the frame of SCV countries. We won't deliver it without it. They just represent too high a proportion of the risk community. But how much attention is being given to conflict and violence as a targeted, specific strategic approach for disaster risk reduction and disaster management community? Well, if we just look at the FDRR itself, even though vulnerability is mentioned on 15 separate occasions, the word fragile or violence wasn't mentioned in any of the 180-page technical guidance. How could we possibly misrepresent or misconstrue the risk of these people within the Sendai Framework? That's perplexing. They are the highest risk with the highest proportion who are at risk. Why have we not a dedicated strategy? Why do not we see dedicated strategies that specifically target this? So let's look at the GAR. Let's look at the GAR 19. Surely, of all documents, of all publications, of all initiatives that relate to the global assessment of risk, we must see some strong evidence of the need for disaster risk reduction and the disaster management community to focus explicitly on fragile and conflict states, given the size that they represent. Surely the GAR, the latest version of the GAR, would help us understand the importance of this, of FCV contexts. Well, sadly, despite my expectation, of the 17 pages that they specifically dedicate to conflict and violence, there is zero global analysis of risk for these communities, or vulnerability or exposure. Zero. There is a zero commentary on program responses that have been successful. Zero. There's been zero policy analysis of any kind, bilaterally, multilaterally, any kind, and zero recommendations on how we're going to reduce the risk. Now, I'm uncertain as to why this is the case, and I am not for a moment criticising the authors of the GAR, but the structure itself must be wrong. There must be a mistake. So I turned to the IFRC report, because their global plan and because of the work that they do in conflict states surely would incorporate as one of the key priorities developing initiatives that are unique and bespoke to FCV contexts. And what did we find? Zero mention of any targeted program. Zero commentary. So why is this so distressing to me? You would say, well, Gerard, you're clearly distressed by this. And why is that the case? And the reason why it's the case is because Ebola showed us why we need bespoke and specific designed responses in FCV contexts. Now, for many of you who are unfamiliar with the Ebola scenario, I just wanted to present the reality for 3 countries, the shocking reality. So many of you know that Liberia and Sierra Leone had experienced conflict for a long time before the evolution of Ebola, and that it had caused an estimated 500,000 deaths. No one's really sure. But Guinea was also significantly affected by the conflict, and it was infected in a number of different ways by people moving in and out of their borders. Well, when the Ebola virus disease outbreak happened in between 2014 and 15, there were 28,000 confirmed cases, 11,000 deaths. That's a case fatality of 70%. 70%. No one was untouched. No one. We have a case fatality rate from the COVID-19 anywhere between 0.1% and 9%. There are 10,000 people who've survived at least that we know have serious medical complications. Over 17,000 children were orphaned. The healthcare worker community was some 30 times at higher risk from contracting the disease. And of course, with a 70% case fatality rate, if they acquired the infection, the chances of them living were low. And the point that I mentioned before about the effect of COVID-19 once it gets into your health system and removes your health system was precisely displayed here. As a consequence of the restricted access, people wouldn't go or couldn't go to the health care facilities. They had a worsening of the pre-existing health conditions that exist, especially in maternal mortality. It increased in Guinea by 38%, in 74% in Sierra Leone, and over 111% in Liberia. So for a mother to die trying to give life is something that we thought we had morally overcome some time ago when we argued in the Millennium Development Goals that this needs to be a focus. You shouldn't die giving life. No one should. Not when for $1 we can remove that risk. So we have here clearly already a scenario of what the potential is for a for a natural hazard disaster event to occur in FCV. What more do we need as a community to turn our attention to the people who are at greatest risk? What will it take for us to shift our thought to where it needs to be? This is urgent. So my solution is a little unpalatable, but it is essential. Otherwise, this is all just fun and games, isn't it? Just a mockery. We have a clear strategy. We have a global agreement. We have over 111 countries signed to the agreement. What's their debate? It's time to act. So we need to declare the whole disaster management and disaster risk reduction and global health community need to declare that we specifically need a focused and a bespoke approach for people living in fragile conflict and violence contexts. And that requires us to develop specific initiatives and specific programs and specific actions that will reduce the risk. We can't take an approach that we use in a different country in a different context. It won't work. It doesn't work. We also need a comprehensive analysis to be driven by the GAR 2021 process. And through that process, the attention that would drawn will bring in the rest of the global actors and responders that are so desperately needed in order to draw attention and to highlight and to shine a light on this particular issue that is hiding. We also need a targeted advocacy campaign across the sector that keeps speaking about this risk, that keeps speaking about the importance of us to act and what is required by the international community and everyone working in it. And importantly, we need an advocacy campaign to bring us back to activities that were fundamental and foundational to humanitarian aid 30 years ago. They were the importance of peace and peacekeeping and the relationship between building peace and global diplomacy for peace and the risk from natural hazard disasters. This is absolutely essential. So I'll just quickly check the time. I've got 20 minutes. So I want to touch on the last or the fourth of the hidden emergencies that we need to address as a community of emergency and disaster workers. One of the important elements within any approach or strategy is the data. How we capture the data, how we measure the data, how we apply the data. And for the Sendai Framework, it's essential that we get it right, because monitoring the data is going to tell us if we're on track. Monitoring the data is going to tell us if we're succeeding. Monitoring the data is going to tell us where we need to go in order to improve the efforts that we're making. How much investment, where, what actions. This is absolutely critical. And of course, target A, the first of the targets for the Sendai Framework, is that we substantially reduce the global disaster mortality by 2030, 10 years. And we're aiming for it to be a lower average per 100,000 between the decades, so between 2005 and 2015 to 2020 and 2030. So the rate per 100,000 deaths, that's what we're aiming to do. So there's a number of indicators that the technical guidance for the Sendai Framework has recommended countries collect in order to answer that question. And essentially they're saying, well, in order to calculate the rate, it's quite simple. You just need to calculate the number of deaths and missing persons attributed to disasters, and you need to divide that by the population times 100, and that will give you your rate. One of my conundrums in looking at Crichton's risk triangle was because the definition of exposure used by the UN sort of included, all your assets and your homes and the environment and everything in the community. I wondered what the denominator was. I thought, wouldn't we try to, in order to calculate the rate of exposure from an event, wouldn't we try to get that denominator as precise as we could, rather than just the whole population? But nevertheless, that's one of the issues that we have with exposure not being particularly well developed as an entity, as one of the functions of risk. But that's a relatively straightforward calculation, and no one has any problem with that whatsoever. Oh, sorry, I've jumped the gun. I needed to go back. I needed to draw your attention to what the Sendai Framework defines as a death. So in order for us to calculate the rate of deaths from disasters, we need to know what a death is. So the Sendai Framework says the death is a number of people who died during the disaster or directly after as a direct result of the hazardous event. So there's a couple of key things. So you've either died during or directly after as a direct result of the event. And you think that's pretty straightforward. So it posed the question, where does this notion or idea of direct and indirect come from? Because that's pretty important. Like, how do we understand direct and indirect? So there was, and how does it exist within this idea or concept of death from disaster? So I found a study that was done by Coombs and her colleagues. It was published in 1999, and they were attempting to try to understand what's the relationship between deaths and disasters, and how do we capture all of that? And so they needed to use a definition that included everything. They really needed to know all the deaths that occurred during a disaster event, so they could use the broad case definition to capture as much data as they could. And the way they did what they thought, well, what we'll do is we'll set up a couple of categories. We'll have direct deaths and indirect deaths, and that will ensure we capture all deaths that occurred during that time. And And that absolutely makes sense to do it that way, to say, well, we're not sure, it might be indirectly related or directly related, but at least we'll capture all the data, and then we can investigate what the relationship was between the event, the hazard, the disaster event, and the death. So this is practical if you're trying to categorize or you're trying to build a framework that's inclusive, but it creates some major problems if you're trying to understand the attribution of the hazard to the death. And what do I mean? Well, if you're affected by exhaustion because you decide to go for a run during the COVID-19 outbreak and you drop dead, is COVID-19 responsible for that death? If you are shoveling snow and are so stressed, or you have a pre-existing chronic condition and you are shoveling snow, or nailing up a placard to stop your windows breaking during the storm, did the storm cause the death? So for such things as these questions, using direct and indirect is not particularly valuable. And I wanted to explain it to you in a simple way if I possibly could. So we have, all of us, everyone listening here and everyone in your homes fits within this framework, within this category. That is, we are susceptible. We're susceptible by a range of different risk factors we can't control. Our age, our genetics, our immunity, whether we have any pre-existing conditions. Yeah, that's what makes us susceptible. And if we're exposed to a hazard, and that hazard causes physiological changes like trauma, blunt force trauma, a building falls on us, or it changes an inflammatory or biochemical reaction. So for example, the COVID-19 invades the alveoli in my lung, and as a consequence of that invasion, it creates an inflammatory process that causes acute respiratory distress, and I can't get enough oxygen into my blood, and I become hypoxic, and I have an organ failure, or I arrest and I have a heart attack and die. That causes death. Very clear. A very clear relationship exists. But there are many circumstances where the relationship is just not clear. And what do I mean by that? Well, it's the same scenario. I'm still there, you're still there with our pre-existing age and genetics, and I may have another disease that compromises my immunity, and so I'm susceptible. And then I'm exposed to a hazard, or the hazard alters my environment. Well, if the hazard alters my environment and is a consequence of those environmental factors being changed, for example, changes behaviour, changes infrastructure, changes money to access that I need for the health system because I've got to pay to go to the health system, creates violence, food scarcity, water, takes out the hospital that I need to go to get my dialysis. And as a consequence of those changes, I experience adverse physiological changes which cause my death. Is the hazard responsible? The interesting notion here is that exposure is actually binary to a hazard. You're either exposed or not. There's no indirect exposure. You can't be indirectly exposed to a hazard. You're either present or not present. Oh, I'm sure that if you're watching television and you watch 9/11, it could be argued that you were exposed to the hazard vicariously through watching the television. But in a practical sense, that's not. There are major problems in going down that route. But for us, we need to unpick this. We need to unpack this and understand it. And it's absolutely critical. So I want to do a test with you. I want to test you to see how you would associate a range of real live circumstances in this event. So I've got 4 examples for you to consider. And these are 4 examples of deaths, and I've listed the disaster hazard that started. So a teenage guy drowned while he was surfing, and he was surfing the storm swell that was caused by Hurricane Irma in Barbados in 2017. So the question we'd ask ourselves is, well, is Hurricane Irma responsible for the boy's death? there were 469 people that were killed in Tranca in Egypt in 1994 when severe thunderstorms created lightning. The lightning struck the oil supplies, the jet fuel that was on rails, and those tanks that were on those rails, on the railway lines, they exploded. The thunderstorms had also caused floods. And what the exploding tanks did was they ignited the fuel. The fuel was carried into the villages and set fire to the villages. So the question is, is the lightning strike responsible for the deaths of the 469 people? Or was it fire? Or was it flood? Or was it another factor? In Australia, 81 people died attempting to drive through floodwaters between, I can't remember the years, would have been over a 10-year period, I'm guessing. It was a paper by Gissing. I can't remember. I'd have a look if someone's keen to know. But 35% of them were driving four-wheel drives. So the question we have is the flood responsible for the death of the person? Do we count that as a death? Do we count it as a motor vehicle accident? Or do we count it as an accident? Like, how do we categorize, how do we use this information to understand, was the hazard responsible for the death? And then the last example is a common example that you see, and a common example cited in the literature, the risk of death from carbon monoxide poisoning in natural hazard disasters. So there were 75 people who died from carbon monoxide poisoning following the event in the US between 1999 and 2009 in either the environment of the flood or the storm. Now, did the flood or the storm cause carbon monoxide poisoning? The flood or the storm reduced power, eliminated the power supply, and people used generators in order to run electricity, warming, and refrigeration and the like, cooking utensils, in which case the carbon monoxide, the odorless gas was generated from incomplete combustion from the engine, of which they inhaled and died. So is the storm or flood responsible? Now, why is this so important? Why is this so important? Well, it's so important because if we go back to the idea of data, the data tell us where we need to focus our attention as a community. And why is that? Well, your disaster risk reduction, do you need to run in the United States disaster risk reduction initiatives to reduce carbon monoxide poisoning in disasters? Is that how we reduce the number of deaths? Do we need a specific program in Australia, a disaster risk reduction program in Australia, specifically targeting drivers driving through floodwaters in order to reduce the number of deaths during disasters? Do we need a specific surfing program, a disaster risk reduction program specifically targeted at surfers to ensure when they surf swells caused by cyclones and hurricanes, they protect themselves so they don't drown? They're really important. So they're really important notions or ideas. Now, one of the problems and where we started with was, well, what's wrong with the Sendai Framework for disaster risk reduction, Gerard? Well, what's wrong with the Sendai Framework is it uses direct and indirect. So if we use the Sendai Framework, all these are included, aren't they? All of these are included, irrespective if you said to me, don't be ridiculous. How could you say that a hurricane is responsible for a surfer who drowned? Had nothing to do with the hurricane. How could you blame floodwaters for people driving through? People drive through floods. They are involved in motor vehicle accidents all the time. Same with bushfires. How could you blame the flood for their poor decision making? They are already at risk. If you remove the hazard, their risk still exists because of the risks that they take. Or what about the carbon monoxide poisoning? Over 100,000 people die every year, irrespective of disasters. Over 100,000 die every year in the US from carbon monoxide poisoning, from the use of generators that are not properly outgassed. Has nothing to do with the disaster. We don't see these numbers of carbon monoxide deaths in many countries, actually. So it's not actually a risk from the disaster, is it? Carbon monoxide poisoning is not a risk from a disaster hazard. So the problem we have is the use of the terms within the Sendai Framework and the inclusion of this data that shouldn't necessarily be there. What we also have is a limiting of time. What the Sendai Framework, and if you remember, I'll just go back up to the top to highlight this for you. It says the number of people who died during a disaster or directly after. Directly after. What does directly after mean? If I'm infected with COVID-19 and it takes me, let's say, 8 days to incubate the infection, and it takes me a further 6 days for the virus to take a hold and start making profound changes, and then I'm ventilated, and I'm ventilated for 3 weeks. Is that directly after the incident? What counts as directly after? But what the technical guidance did is they provided some guidance for countries in order to understand what this means. And I want to read this to you so it's really clear. Temporal aspects for attribution and cutoff for data collection. Countries may choose to have different time frames for each hazard because they have different epidemiology. So you and ISD are clearly recognising that the epidemiology of disasters and natural hazard disasters and how they affect people differs. Yeah, excellent, fantastic. But then it goes on to say, if so, timeframes for each hazard should be based on the epidemiology of survival rates during the event and the feasibility of recording deaths. And the technical guidelines go on to recommend a time cutoff. So for drought, 6 months after the emergency state ceases, you can record deaths from this disaster. After a flood, 4 weeks after the event. For an earthquake, 4 weeks after the event. And for an epidemic, when no new cases were recorded. So there are clear time barriers, clear timelines to restrict or to recommend when you stop counting deaths after a disaster hazard. So I thought, let's test that. Let's do an analysis to test to see how relevant this is. So what I did was I looked at the medical literature. I used Scopus and the keyword mortality or death, entitled an abstract, and included a range of different hazards, the hazards that we know cause the highest mortality or have done over the last decade globally. And I limited the articles from 1990 to present and further limited to published in English. And what I discovered was there are about 4,000 references, and after removing non-related content, because as you know, as you're all familiar with, when you do a search, you often find it picks up on some of the words and includes things that you're not interested in, like, you know, a 9/11 or like a terrorist incident or circumstance that is not really related to this. So after I removed that non-related content, there were 624 studies, of which 302 were chosen, and they were reviewed and analysed. And I couldn't do for all of the hazards that we've listed. I didn't have enough time, so I chose the 4 of the highest mortality. So earthquake, storm, extreme temperature, and flood. And what the analysis showed was fascinating. What the analysis showed was that the record of deaths on all of that medical and scientific literature for the 4 events occurs, as we would all expect, at different times after the event. Now, if we look at earthquake, of which we have a shut-off of weeks, or 4 weeks, we can see after that 4 weeks period, we still see a significant range of deaths that occur from coronary heart disease, that's what that CHD is, cardiovascular accident, so a stroke, from COPD, so these are chronic conditions of the lung and airways that cause people to have difficulty breathing, for wound infections, so they may receive a cut or an injury or a laceration to their skin, and infection gets in, and that infection gets into their bloodstream. Suicide was interesting. There were a number of different papers that related to the incidence of suicide in the months after the earthquake onset. And again, in the years following, fetal loss occurred in high incidence. So these are all excluded once we time limit. If we go to storm, it's a similar situation for chronic diseases. For chronic diseases, so asthma could be included within COPD, but so asthma, cancer, coronary heart disease, so heart failure, someone having a heart attack, for diabetes, interestingly with storms, and for cancer. These deaths at higher rates controlled in the population. So these are studies that have been undertaken, the epidemiological studies that are undertaken, that are not just counting deaths, they're actually controlling for the period of time at which they would expect these deaths to occur, and finding that there are higher numbers relative to the ordinary period of time and relative to the rest of the population not affected. And a similar challenge for floods. And what's interesting about floods is mortality from infectious diseases or infectious agents that have much longer incubation periods before they cause illness and death. What's also interesting is within floods, it's exposure to toxic chemicals or heavy metals that leads to or requires a compounding effect in order to lead to death. If we limit death from disaster, we misunderstand the risk. We misunderstand the risk to the community. Now, I wanted to explain some of the solutions to this relative to where we are at within the Sendai targets. And what's critical is that we have to understand that even though the Sendai Framework was started in 2015 and work undertaken in 2015, it's taken some time, a lag time, in order for the world to catch up. And if we look at targets A and B, so reducing mortality and the number of people affected is target B. And we see what proportion of countries have provided information on this. And we can see 83% of countries have reported on deaths, 70% missing persons, 70% injured or ill, 39% people whose livelihoods were disrupted or destroyed. So that's good and somewhat lacking, we could say. And I wanted to include this because targets E and G are really critical because they talk to the heart of this. What are the DRR strategies and early warning systems that have been implemented? Well, we see that half the world have strategies. 40% of the world, these strategies are at local governments, and some 60% have early warning systems, whatever that may entail. So we've still got a fair way to go in order for us to get to a place where we can accurately understand whether we're going to deliver the Sendai Framework. And keeping that in mind, so based on that, these are the actions and leadership that I believe is required in order to address these issues as I see them. So we need to start recording cause-specific mortality. And what does that mean? That sounds a bit jargonistic, a bit technical. It's not. Anyone who's looked at mortality data, all of you, it simply says deaths. Well, but how did the person die? If it's a flood death, did the person drown? Did the person arrest in the flood water? So in other words, have a heart attack when they were struggling through the flood water, fall into the water and then drown? How did the person die? Because unless we work out how the person died, you end up getting crazy recommendations from different parts of the community. For example, we need to teach people how to swim in floodwaters in order to stop drowning. So and that was genuinely proposed. It was genuinely proposed in a paper that was written for the GAR-19. It has no basis, no scientific evidence to support it, but it's based on the idea that around how deaths occur in floods. But it's really significant and really important. Cause-specific mortality is essential because how we respond to floods in Queensland and northern Queensland is going to be different to how we respond to floods in India or Bangladesh. So knowing how the death was caused is absolutely crucial, and we need to get there. We need to advocate for this. But that's not that simple. As we've played out in this idea of direct and indirect mortality, this curious concept of direct and indirect mortality, how can mortality be indirect? We would need technical guidance that allows countries to say, this is how we attribute death from the disaster. So if a person dies in this way, this is how we're going to say this was caused. We can attribute this death to the disaster. There is a clear link between the death of the person and the disaster hazard. We absolutely need improved death certification. Remember, there's still such a significant proportion of deaths that are not registered. The most fundamental of data capture is to know whether a person is dead or alive, and to capture that data, to record that data. And yet such a large proportion of the world does not have a strong enough developed certification, a vital statistics certification system in order to do that. And this sort of leads back to the idea of, well, where's the support to help low-income countries develop those systems, rather than monies going to finance and infrastructure. What about some fundamental systems to help them be able to record deaths accurately, so that the data exists for programs to know whether or not they're working effectively to reduce the death? One of the areas that we must work on also as a community is more innovative ways that we can capture death and we can report that death, where that vital registration system, the vital statistics, the CRVS systems, are not robust for reasons. CRVS systems are not robust in low-income countries. And the two last points that we as a collective need to focus is a domestic and global advocacy drive that draws attention to the problem that we have in recording death, and to develop agreed solutions to put in place so we can all report death and its cause more specifically. And the last element that we need is perhaps the most important of all for countries, in my view, and that is we need to build epidemiological profiles. What's that? What's an epidemiological profile? An epidemiological profile is a description of what disease and illness and deaths occurs during a disaster hazard. Yes, absolutely. We don't have them. No, it hasn't. Yes, 100%. I know you're perplexed. I know you think that sounds absolutely crazy. How is it that for each country we don't have a clear guide that says these are the injuries and these are the issues and these are the deaths that occur as a consequence of this natural hazard? No, we don't. I know it sounds, you'd be astonished. Okay, so take Australia for example. Australia, for example, is a simple example. You've been involved in disaster management in the territory, in another state or in another environment, and all of you at some point in time would have been led to or set up or developed or been involved with an emergency recovery centre developed by the council or the state. Yeah. Well, there's zero risk assessment done of that environment to begin with. And the idea that we would put people there to protect them from a hazard and actually cause greater harm would be preposterous, right? Yes, of course. But that's exactly what happened in the bushfires in the eastern states. Our recovery centres were surrounded by smoke of concentrations that we were not even aware of because we had no monitoring. And yet the coughing and the respiratory distress caused of thousands of people who were placed in those centres that we developed in order to protect people from the fire hazard, we're actually putting them in harm's way. We have no data, no information, no recommendation in this country, in Australia, about the risk from the inhalation and exposure to PM 2.5. That is particulate matter, so that's the particles that are in the air. Yes, for ozone, which was part of it and part of the fire, but none. We didn't do any monitoring of that air quality around those centres where we put those people. So it's absolutely essential, not just for low and middle income countries, but for high income countries especially. This is crucial, clear epidemiological profile. And such profiles will also avoid and take away the politics that come with disasters and how many people died as a consequence of disaster, which is front and centre, has been in hurricanes, has been in fires, and will continue to be, unless we address this as a community. I just want to leave you with one last thought. You've been very patient and I appreciate that. I just wanted to leave you with one last thought. It's actually from a a well-known toxicology book that was developed by a professor of toxicology. And it says this, it says, we are part of the ecology, although we like to view ourselves as being insulated from it. We must recognise that all of the components of the environment are necessary for our continued survival as a species on this delicately balanced rock that's called planet Earth. Well, thank you for your attention. I'm very happy to take any questions you have. I know it's an enormous amount of content. I'd hope to take questions after it, but I was so short of time. Perhaps I need to speak less and listen more. But thank you so much, and please feel free to ask any questions. Thank you.
Well, thank you very much, Gerard. I think this was not only a comprehensive presentation, but also equally insightful, very, very in-depth and thought-provoking, touching on global, regional, national, and local risks, and risks which can also be amplified extraordinarily by even the little increase in either hazard, vulnerability, or exposure, or all of these in combination. You also highlighted that as human species, we are very much globally connected, and we as residents of this lucky country can't remain muted to what is happening or what is ongoing in other parts of the world, including FCV, LDC, or other neighbors in the Pacifics and the Asian region. You also did highlighted that every dollar spent on the overseas development assistance is actually an investment to increase our own human safety, security, and well-being. And I think that in the concluding part of your presentation, you did very well highlighted the need for cause-specific disaster mortality. In the interest of time, I would like to invite people who would like to use microphone and ask questions. Gerard, if you're able to see the chat room, you can see a couple of comments made already in the chat room. One was from Dr. Jonathan Lassa. Hello, you there?
Are you able to read those out to me, Akhilesh? I just can't see the chat room.
Sure. Dr. Lassa is saying that in your slide 24 on biodiversity, there are heaps of international conventions, probably hundreds, including UN Convention on Biological Diversity. What he's saying is that lack of compliances and enforcements are some of the culprits, and Paris Agreement targets have been helped by COVID-19 in a way. That is with a question mark he has made this. I think this is more of observation than a question, but you can feel free to comment on this.
Yes, thanks, Akhilesh. So the global governance response that he was talking about, that I assume is referring to something that was run or agreements that were run out of the US, or are they more regional? Is he able to talk to that? Because it's a really important point on diversity and ecosystem loss, and how we're trying to manage that as a species. Given what's happened in South America over the last 3 years, with the phenomenal damage that's been done in Brazil, especially to the Amazon, and the ongoing burning, and similarly the damage that the US seems to pursue, especially with their even greater removal of restrictions of any environmental protection around industry or from industry. I'm just wondering if he's able to comment on these elements. I was unable to find agreements that had been signed universally, I guess, unlike many of these where greater than 150 countries agreed to these initiatives.
Thank you, Gerard. Let me see if anyone who is currently in the online seminar room would like to use microphone and ask any question or make any comment to Gerard. If none, then I can move on to the next comment by Belinda Maubey. She's saying that fantastic, thank you, interested in your thoughts around the key simple messages to deliver that assist the public to make the link between COVID-19 and broader environment issues so that the message is received, informs action, and doesn't look like the person delivering the message is dismissing the COVID-19 emergency and running a personal agenda. Avoiding it being politicized. For example, it is also about timing of when the message is delivered, as well how. Recognizing that when people are in a panic, it can impede people's level to absorb information. Jared, any comment on this?
Yeah, sure. There's a couple of points within that. So I'll separate my answer into two factors. One is the basis of the first part of the question, which was how do we enable people to understand that the heart of COVID-19 is the environment, and how we are treating the environment that's putting us at risk from the emergence of different pathogens that exist in other animal species, and plant species, by the way. But so how do we make that link? How do we tell people that that's the reality? I'm not sure I have an answer to that, and the reason why I'm not sure I have an answer to that is because I've been frustrated, more than frustrated, by the state of selfishness of the world, and the belief that each individual is able to continue to do anything at the expense of anything. I know that sounds a bit harsh, but you know, we have been for a decade or more shown by any scientist working on major systems, oceans, forests, air, the planetary forces, that we have to change the way that we are living, because our climate is changing in a way that won't allow us to live or evolve with enough time to live in the environment that will be created for us. And despite a decade of messages around this, and in Australia, you know, the messages don't always get out because of media interests. You know, the media interests tend to run the agenda within the society, and they take a particular tilt or slant to how they want to report things that they find or not find. But we have done nothing. Our country has done nothing. We have the most to lose. We are the driest continent on the planet, Australia. The driest continent on the planet. And yet, and despite, and in spite of all of what we have to lose as a country, we are the quietest on climate change. We wanted to withdraw ourselves in 2019 from the Paris Agreement. We have called the science to support it bunkum. And here's the great thing. The people who are saying that this information, this scientific work is not real, they have neither the knowledge nor the education to evaluate the science. Yeah, none of them do. None of our politicians, or bar a couple maybe, have the knowledge needed to evaluate whether the science is true or not. So what that means, the only possible meaning could then be, well, they don't believe the scientists. So why wouldn't they believe the scientists? So this is the question we would have to ask ourselves, because they don't have the ability to disregard the science because they are learned in that field. And the science is unequivocal and gaining in strength every day. So it's that they don't believe the scientists. So if our politicians don't believe the scientists, then the message to the public is to distrust the scientists' messages. And that's what's disheartened me, because that can be the only thing. John Howard was asked by the presenter of the 7:30 report, Lee Sales, Only 2 years ago, and John Howard said, as you know, Lee, I'm a climate change agnostic. And instead of the reporter saying to Mr. Howard, well, Mr. Howard, how could you possibly still be agnostic? Because all of the burden, all of the evidence, everything, it is unified now of the reality of anthropogenic climate change and the risk it posed. How could you possibly still be agnostic? What is it that's prohibiting you, Mr. Howard? But she didn't ask that question. But that's the question that needed to be asked. So I'm not sure how to have that conversation with the Australian public. It needs to be had, though. So the second part of your question was, especially to COVID-19, I don't know how to get there with that. The second part of your question was the political process. You have to depoliticise it for the very reasons I've just said. And depoliticising it, I'll give you a great example. Look at any of the footage of the fires in Australia, any of the footage. And who headed up every media release? It was the head of the fire authority, the head of the RFS in New South Wales, the head of the fire authority in Victoria, the head of the emergency services and fire in South Australia. It was a technical person who headed up the communication every single time. The politicians were not involved. They did not direct. They did not advise. It was non-political. It's political at the Commonwealth level, but that's because of the Prime Minister's view about his leadership, sadly, and his inability to hand over that what he would describe as power. It's not power at all. It's just organisation and direction to discrete, explicit groups. Politicians can only see it through a political lens. But it's a good example of how you hand over. If we had handed over for COVID-19, Australia would have been a shutdown a long time ago. There's no way we would have allowed. Let me put it to the colleagues who are still on this line. Let me put this to you. How extraordinary is it that on the 1st of February this year, that all people from China were prohibited from coming into Australia? We stopped all folk from the area under the proviso that this was where the burden, this is where a great outbreak was occurring, and so we would stop people coming in to reduce our risk. Excellent, good idea. The only way to do it here. We've got to give the virus nowhere to go. We've got to stop the local transmission from person to person. Best way to do that, stop people having contact. We knew in the middle of February that there was an unparalleled and exploding outbreak in Washington state. We knew that. And the problem was in the United States is they weren't testing, and the transmission of the virus was going sideways. And from the 15th of February to the end of February, the number of people arriving in Australia from the US that was creating the transmission dynamic here was clear. It represented over 1/3 of all our cases from the US. And yet, despite that, people from the US were still flying into the country up to last week. Perplexing, completely hypocritical. You can't have one circumstance for one and one circumstance for another. The expert committee would have never allowed that from happen. It would have shut the door a long time ago. And that's why you have to remove politics. It's absolutely essential. I won't speculate any further on how we could have contained the virus, but we should have acted faster. We should have acted harder. It's true that we didn't experience SARS and that didn't prepare our country for what was needed. But we should have gone hard at this because the shocking circumstances in other countries now, Indonesia, especially Indonesia, the United States and the United Kingdom is enough evidence. We need to see how horrible this is. Thanks for the question.
Thanks, Gerard. And one of the last question is saying that any thoughts on how we evaluate the effectiveness of disaster responses? How often do we take into account a value for money approach when planning our risk reduction?
Okay, wow. Thanks for the question. Yes, it's a difficult, a very difficult question. And it's a difficult question because one of the challenges that you face is answering the question, what is value? And when you say value for money, what does that, unpacking or defining what you're going to mean within value for money? What is value? How much value do we accord to life? If you save one life, how much value do you allocate to that life that you've saved? One life. If you're evaluating the effectiveness of anything, of any intervention, if you're evaluating the effectiveness of any program, developing parameters by which you measure the program can only ever be based on the objectives of the study. And so structuring the study in a way, or structuring your evaluation in a way that's always coming back to what was your objective? What was my aims? What was my objectives? And how am I measuring whether these aims and objectives are met? The challenge that we face as in comparing programs that were run in different areas with the work that we do is understanding the context at which the program was implemented. It's very difficult. It's very important, but it's very difficult because the context enables or allows anything. And as the context changes, your ability to be effective may change. And let me try to give you an example to help you understand that. Let's say that the program that you're implementing is a respite and recovery recovery program for people affected by, we'll say, the bushfires as an example. That's been the most horrific circumstance we've had in this country for a while. As we all know, our recovery starts immediately. Our recovery starts at disaster onset. That's where we need to start recovering. We're preparing the community to recover, yeah. Well, if we look at any of the communities that were affected by these bushfires, any of the communities, the context changed continuously while they were trying to implement their respite and recovery programs. It continued to change, and the information continued to change, which affected the ability for them to implement the program. For example, people were told that they weren't allowed, they would have to leave the area that they were in and couldn't gather their belongings. So many people who were on holidays who were affected by these fires arrived because they were told in the recovery centres they had to go there because their lives were at risk. So they brought all the things with them that they'd taken for holidays, that be it in a caravan or be it in the car or wherever, and they arrived with all their belongings. They were told they couldn't remove those belongings. Those belongings had to stay there. The level of anxiety and apprehension that decision caused, it could never be captured unless you were there implementing the program. That context element that would have affected the ability to succeed in the objective of keeping people calm, keeping people safe, keeping people well, keeping people healthy, would have significantly affected this. So understanding your context is critical to evaluate effectiveness. But unless we talk about value for money is often written in the literature, and the issue that I have most with this idea of value for money is that it's not explained what value means. How much value do you accord for each part of society? And this is what any scholar or any researcher or any epidemiologist needs to test and understand to make sure that definitions are unequivocal, are explicit. No term within your evaluation method or no term within your evaluation question can be anything other than clear. All your terms need to be clearly defined. It's a really difficult task. Evaluation is a really difficult task. One of the expressions that I hate most in the world is lessons learned. I hate this expression. I hate this expression is because the lessons aren't learned. The only time we should ever use this expression, lessons learned from an evaluation, is for the next disaster, when we evaluate the next disaster and say, well, we actually learnt the lessons from the first disaster because this is how we changed. But I see often well-meaning NGOs use this expression, they're not lessons learned, they're just key aspects of evaluations that they identify. Let's get to the next disaster and see if they're lessons learned, because from where I've sit, from a decade of experience in working with communities, I tell you, there's not too many lessons that are learned. I continue to see the same issues arise in evaluation, in implementation, in program design over and over again. Anyway, I'll stop there. You've been very kind to listen. Is there anything else, Akalesh?
Thank you very much, Gerard. Thanks very much, everyone.